Hello there, adventurers. Today we are going to dive into a topic that is as breathtaking as it is challenging, and that is high altitude sickness. Whether you're a seasoned mountaineer or just someone who dreams of reaching great heights, this video is your ultimate guide to understanding and tackling mountain sickness. So buckle up and join me as we unravel the captivating tale of high altitude sickness and the body's remarkable journey into thin air. Altitude sickness is when your body doesn't have time to adjust to a lower oxygen availability higher up in the atmosphere. It's usually preventable and treatable, but if it's severe, it can rapidly turn into a life-threatening concern. So, what is considered a high altitude? High altitude is an elevation of 1,500 to 3,500 meters. If it's around 3,500 to 5,500 meters, that's called a very high altitude. Above 5,500 meters is considered as extremely high altitude. This is a tiny oxygen molecule in the environment. When we breathe, oxygen travels into the lungs because of the pressure gradient. And inside the alveoli, the hemoglobin in the red blood cells will pick this oxygen into their tiny pockets and head towards the cells who need oxygen. So what's the difference between the pressure at sea level and the pressure at an elevation? The atmospheric air pressure, also known as PATM, decreases with altitude. At the sea level, it's around 760, but at the top of a mountain with the 3000 meter elevation, it can reduce up to 500. So from 760, it can reduce up to 500 at an elevation of 3000 meters. But the fraction of inspired air, also known as FiO2, is still remaining the same. That's 21%. At sea level, atmospheric pressure is high, so they have high oxygen levels. At an elevation or a mountain, this atmospheric pressure is low, so they have low oxygen levels. As a result, the amount of oxygen that is getting into the alveoli reduces. So the individuals are unable to take up as much as oxygen at that altitude, which results in a reduced oxygen delivery around the body and to the tissues. The body will usually compensate and keep the tissues well oxygenated even at a low atmospheric pressure. This process is called acclimatization. The body achieves acclimatization by reducing the renal bicarbonate excretion to correct the respiratory alkalosis, stimulating the kidneys to increase the production of erythropoietin to increase the oxygen transportation in blood, and finally by increasing 2,3-diphosphoglycerate, also known as 2,3-DPG, which will shift the oxygen dissociation curve to the right and allowing increased oxygen offloading at tissues. So if an individual ascends too quickly, their body doesn't have the chance to acclimatize, so they may start to develop symptoms of high altitude sickness. In order to compensate for the low levels of oxygen, the body tries to increase respiratory rate so that they can reduce the hypoxic situation. So these patients will be hyperventilating, and this can eventually lead to respiratory alkalosis. Along with the respiratory rate, heart rate is also increased. High altitude illnesses is usually experienced in altitudes more than 2,500 meters of elevation, but susceptible individuals can experience it even at a lower elevation. So what are the risk factors? Fast rate of ascent, greater altitude reach, the altitude at which a person sleeps, previous history of altitude sickness, exertion at the arrival of altitude, pre-existing cardiovascular conditions like congenital heart diseases and angina. There are three types of altitude illness. Number one is acute mountain sickness. This is the most common and the mildest form. Second one is high altitude cerebral edema, which is also known as HACE. Number three is high altitude pulmonary edema, which is known as HAPE. HACE and HAPE are severe conditions, but acute mountain sickness, also known as the AMS, is the mildest form. Acute mountain sickness or AMS can occur up to 25% of individuals climbing to altitudes of 2,000 to 3,000 meters, and up to 50% of those climb into altitudes of 3,500 to 4,500 meters. Symptoms of AMS don't usually occur in the immediate ascent, and they tend to present after 6 to 10 hours of reaching the altitude. A key feature to note is AMS can progress into high altitude pulmonary edema or high altitude cerebral edema, which are quite life-threatening. Acute mountain sickness usually takes around 1 to 3 days to resolve, and these patients will present with headache, gastrointestinal symptoms like nausea and vomiting, fatigue, weakness, dizziness, shortness of breath in exertion, and tachycardia. These symptoms are only a guide, but any new symptom which occurs after ascending to an altitude is considered altitude sickness until proven otherwise. High altitude pulmonary edema. High altitude pulmonary edema is the respiratory manifestation. In here, there's fluid accumulation in the lungs due to the pulmonary edema. This usually presents after 2 days. These patients can present with breathlessness, orthopnea, wet cough, hemoptysis, wheeze, and chest tightness. If untreated, they can progress into respiratory collapse and unfortunately death. High altitude cerebral edema is the neurological manifestation, and it's the most severe form among the altitude sicknesses. It commonly precedes acute mountain sickness and usually occurs after 2 days of ascending up to an elevation of 3,000 meters to 4,000 meters. There's a buildup of fluid in the brain, which is causing the cerebral edema, and these patients may present with altered consciousness, ataxia, and confusion 2 hours post-ascent. And they will also have a persistent headache. The diagnosis is based on the patient's signs and symptoms. Acute mountain sickness, high altitude pulmonary edema, and high altitude cerebral edema are all clinical diagnoses, and severity is usually subjective based upon the intensity of the symptoms. And we can do simple examinations like auscultating lungs for the crackling sounds in high altitude pulmonary edema and assessing the GCS in high altitude cerebral edema will give us a clue. Management. Anyone that develops symptoms should stop further ascent, and the travelers displaying any signs and symptoms of altitude sickness should not be left alone, as their symptoms may progress and become life-threatening. For acute mountain sickness, these patients are advised to rest. Simple analgesics can be taken to relieve the headache, and it usually takes around 1 to 3 days to fully resolve. For mild to moderate cases, oxygen can also be used. For high altitude cerebral edema and high altitude pulmonary edema, these individuals require urgent medical attention and should seek descent as quickly as possible. They need to be supplemented with oxygen. Portable oxygen chambers can be used to increase barometric pressure to allow the greater inhalation of oxygen. Nifedipine and dexamethasone both have been proven to help in prophylaxis and the treatment of altitude illness. So how can we prevent this? The majority of preventive measures focus on ensuring the ascent is gradual and that the patients sleep at an appropriate altitude to which they have gained. So once over 3,000 meters, sleep elevation should not exceed more than 500 meters a day. Preventive measures are more useful in individuals with moderate to high risk of developing altitude sickness. Acetazolamide is recommended to be taken before climbing the mountain. So, high altitude sickness becomes more than just an obstacle. It's a teacher, a reminder, and ultimately a part of the adventure itself. For as long as the mountains stand tall, the tale of conquering high altitudes will continue to unfold, reminding us that in the face of challenges, the human heart is the most powerful peak to ascend. I hope you guys learned something today, and if you did, please hit the like button and comment your ideas, and subscribe to my channel for more content like this. And as always, thank you for watching. I'll see you on the next video.